Alzheimer's disease, a looming shadow, but not without hope. Alzheimer's disease, a form of dementia, casts a long shadow over millions of people worldwide. It's a progressive brain disorder that slowly erodes a person's memory, thinking skills, and ability to perform everyday tasks. But understanding the disease and the recent advancements in research can empower you to face it with knowledge and hope. The stealthy intruder, plaques and tangles wreak havoc. Alzheimer's isn't a wear and tear consequence of aging. It's caused by abnormal protein buildups in the brain called plaques and tangles. Imagine these protein clumps as sticky cobwebs slowly strangling communication between nerve cells. Plaques, composed of beta-amyloid protein, lurk between nerve cells, while tangles, formed by tau protein, twist inside them. This disrupts the brain's intricate messaging system, leading to the characteristic symptoms of Alzheimer's. Risk factors, a web of influences. While age is the primary risk factor, with chances increasing after 65, it's not the only culprit. Genetics plays a role, with a higher risk if a close relative has the disease. Lifestyle choices like smoking and a poor diet can also tip the scales. Head injuries sustained throughout life are another contributing factor. Understanding these risk factors can help individuals make informed decisions about their health and potentially lower their risk. Early warning signs, a subtle shift in the fog. Alzheimer's symptoms often creep in so gradually that they can be mistaken for normal forgetfulness that comes with aging. Here's where being aware of the early signs becomes crucial. Mild forgetfulness, especially about recent events or conversations, is a common starting point. People with Alzheimer's might struggle to find the right words or follow a conversation, their grip on time and place loosening. Planning and judgment become impaired, and familiar tasks like balancing a checkbook or following a recipe suddenly feel overwhelming. Recognizing these subtle shifts and seeking professional help can make a big difference in the long run. A relentless journey, the stages of Alzheimer's. Alzheimer's is a progressive disease, meaning it worsens over time. The progression can be divided into stages, each marked by a deepening fog. In the early stages, mild memory loss and difficulty with familiar tasks like managing finances or planning a trip might surface. As the disease advances, memory loss becomes more severe. Confusion and personality changes set in. Daily activities like dressing or bathing become a struggle. In the later stages, complete dependence on caregivers becomes a reality. Diagnosis and treatment, facing the challenge. While there's no cure yet for Alzheimer's, there's hope. Early detection and intervention are crucial. Diagnosis typically involves a cognitive assessment, a medical history review, and brain imaging scans. These tools help doctors differentiate Alzheimer's from other forms of dementia. Medications can help manage symptoms like memory loss, improve thinking abilities, and regulate mood swings. Therapies can provide valuable support, not just for the patient but also for caregivers, teaching them coping mechanisms and strategies for daily living. Living with Alzheimer's, a journey for caregivers too. Alzheimer's isn't just a disease of the patient. It takes a toll on loved ones who become caregivers. The emotional and physical demands of caring for someone with Alzheimer's can be immense. Fortunately, there are resources and support groups available to help families navigate this challenging journey. Understanding the disease, learning effective communication strategies, and connecting with other caregivers can make a world of difference. A beacon of hope in research. The fight against Alzheimer's is far from over. Researchers worldwide are actively exploring ways to prevent, slow the progression, and even cure this devastating disease. Promising avenues include gene therapy, new medications that target the protein buildups in the brain, and lifestyle interventions focused on promoting brain health. Clinical trials are ongoing, offering a glimmer of hope for future generations. Remember, Alzheimer's disease may be a daunting foe, but you don't have to face it alone. With early detection, proper management, and the unwavering spirit of research, there is hope for a brighter future, even in the face of Alzheimer's.